I'm Dr. Mo from Spark Sports Medicine, and I'm going to talk about the importance of early intervention with concussions, particularly acute concussions. So, a lot of times we get the question when people call in after an acute concussion, how soon do we need to see our healthcare professional, our doctor, and what is it that we do in the early setting? And so there used to be a time where it was just about absolute rest, but the recent research, particularly the fifth consensus that recently has come out, has really highlighted the importance of early intervention to decrease morbidity in these acute concussions. So yes, in the first 24 to 48 hours, and depending on the case, it may be that absolute rest is necessary, really focusing on avoiding triggers, bright lights, loud noises, excessive cognitive loads, dehydration, poor sleep, etc. And as we get beyond that, the research has really supported early intervention with a combination of cervical rehab, vestibular ocular rehab, and a return to learn plan, which is basically cognitive accommodations, particularly for work and school. So, and then eventually active or exertional rehab as well. These have all been researched well, and the idea is that if they're implemented early, and by early we mean as early as 24 to 48 hours, depending on each case, then it reduces the morbidity, actually improves outcomes, it improves the time to recovery. So again, these components are going to be, if a lot of head injuries do have whiplash mechanism to the neck, and so cervical rehab can help reduce the symptoms from that and the cervicogenic headaches that may occur from having a stiff, painful neck. Vestibular ocular symptoms are very common. 70% or so of patients, majority of patients after acute concussions will have some component of vestibular ocular symptoms. Some may be more balanced or vestibular, others may have more functional visual deficits. Regardless, that's something that we can rehabilitate. It's also something that we need to understand so that we limit the visual loads and even the vestibular loads that someone has in a given day through school or traveling or driving or those kinds of things. Cognitive is very important. So cognitive symptoms are often overlooked, particularly in younger patients. So young developing brains have a lot more cognitive symptoms, and in general they're very common. So and they're harder to examine, and that's why it's really important to have some sort of ability to do some cognitive testing. We utilize a couple of different computerized cognitive tests. Impact is sort of a large-scale one that's used a lot, well-validated test. There are others, but regardless, you can take a 30-minute cognitive test and have an understanding of where your cognitive deficits are and how severe they are in general, and also be able to tease out, are there more processing issues or memory issues? Are those memory issues more in visual memory or verbal memory, etc., etc. And ultimately, the results of the cognitive testing and a better understanding of the details of the cognitive impairment will result in putting together a return to learn plan. That return to learn plan is usually a combination of very specific accommodations that patient may need or that student may need at school or at work, and also instructional strategies that can be helpful in allowing them to be successful in the classroom, have the right amount of cognitive load without getting overloaded, because remember, their cognitive function has decreased. So return to learn is another very important piece to early intervention that we like to get going right away, instead of kids sort of just being in school trying to do as much as they can and doing tests and things like that can definitely exacerbate their symptoms and prolong their recovery. The active rehab protocol or exertional rehab, all the recent research has shown the earlier you can initiate that, the better. Obviously outside of 24 to 48 hours, which is really one of the big highlights of the fifth consensus. And all that means is, everyone's different, and some people may not be able to tolerate any exertion until they're a week out, a couple weeks out. But in general, our goal is after the acute window, 24 to 48 hours, to see if people can tolerate a little bit of exertion, just a light dose of exercise for its therapeutic benefits, which there are many with respect to physical symptoms, sleep, mood, cognitive symptoms, etc., etc. So we really want to get those therapeutic benefits, but of course without the risks. So what we need to do is do this in a monitored setting, supervised. We usually test them, monitoring their heart rate and blood pressure while they do a light exertional load on a stationary bike, for example. So we're controlling a lot of the variables there and seeing, do they tolerate that? And as part of that, a dysautonomia evaluation is also important to do, looking at the heart rate and blood pressure response to exercise very objectively to see if that's appropriate response. Because if the brain's not ready for the exercise, you will see wacky things with the heart rate and blood pressure, and that means that you're not ready to do that level of exercise. And at the end of the day, whatever we're able to achieve in the monitored setting without symptoms, without signs of dysautonomia, normal objective monitoring is the goal moving forward for the next week or two, of course, until we see the patient back. And as they recover, then they can progress by doing more and more exertional loads, ultimately until they're able to tolerate max exertion. So these are all the different pieces that are critical to early intervention after a concussion. And the bottom line is, it's no longer absolute rest, stay home from school, don't do anything. It's relative rest. So we need to identify where your thresholds are with respect to cognition, exercise, other triggers, and keep you in your sweet spot, which is usually 10 to 20% below wherever that threshold is. So figuring that out and having a plan where student athletes, adults can be at that sweet spot is the key to stimulate recovery in a rehabilitative way and not exacerbate symptoms and cause problems.